It doesn't get much better than a 5-star rating. And Peninsula Regional Medical Center has done it again. For the third consecutive year, PRMC has been awarded the highest rating by the Centers for Medicare and Medicaid Services.
PRMC is one of just 8 hospitals in the state of Maryland and the only one on Delmarva to receive this rating. We're going to throw it out to Katie now to find out what hospital officials have to say.
Jimmy and Lisa, I think a 5-star rating calls for a high five. We're here with Sarah Arnett, who's the Chief Nursing Officer and Vice President of Patient Care Services. Sarah, first, congratulations.
Thank you very much.
Tell me about what this means to the team.
This is very exciting for our team. We're very proud of all of our team members that contribute to the care of our patients every day. And it's a direct reflection of their commitment to doing so for our community and providing the best health care possible.
And you guys just recently partnered with Nanticoke Memorial Hospital, and they got a high rating too.
Yes, our partnership began formally January 1st of this year. They received a 4-star rating, which is also an exceptional reflection of the dedication they have to their community and the folks that they serve. We're very happy to be partnering with them, and we're examining best practices between both facilities so that we can become a stronger system.
Congratulations to them as well.
Yes, absolutely.
Another proud staff member is Debbie Sheets, the Vice President of Organizational Effectiveness. Congratulations.
Thank you very much.
Tell me how CMS determines its ratings.
Well, CMS uses 7 different statistical models to determine its star ratings, and these include measures such as mortality rates, patient safety indicators such as infection rates, other complication rates. They look at readmissions, how well we keep our patients well out of the hospital, and they look at things like efficiency of care, how well we utilize our medical imaging services. And we did really well on our patient safety indicators and really well on patient satisfaction, better than the Maryland average.
That's awesome. So beyond ratings, what in your opinion makes an award-winning healthcare team?
Well, an award-winning healthcare team starts with very engaged staff, and we're very fortunate to have engaged nurses, physicians, pharmacists, radiology techs, respiratory therapists, housekeepers. It really takes a team, and we're really, really lucky to have them. They're constantly working on performance improvement activities in their departments. They get engaged around organizational goals and objectives. That's really the core of patient safety and patient satisfaction.
Well, keep up the good work.
Thanks so much.
Thank you, Debbie. An example of that award-winning healthcare is PRMC's Cardiac and Pulmonary Rehab Program. We're spending the month of February introducing you to folks who've had their lives changed by the program. Time now for you to meet 74-year-old Daniel Savoy of Salisbury.
I guess it was back in 2006, 2007, was beginning to lose a little pep in my step. And once I went to my physician, I have checked, he recommended that I see a cardiologist. They determined that there was one vessel that had some blockage, but it was inoperable, labeled as angina. So that's what I have, which is I feel pressure in my chest at times, and there's medication that helps to relieve the pressure. And at that time, I came into this program. I used to prize myself in being able to climb the stairs without stopping. And then when I realized that that was becoming more difficult, then that was more frightening than it is today. Sometimes in the winter when you're not getting out as much and so forth, I'll come an additional day or two here for the exercise. And with angina, you have to get your vessels dilated so that sufficient blood can flow before you do the full extent of your warm-up. There's that camaraderie that you develop, and if someone doesn't show up for a session and so forth, there's always someone who will inquire, have you seen so-and-so? And it is that type of atmosphere that's really heartwarming. We have learned so much more about the elderly and the need to exercise, and you listen to your body and so forth, you can have more birthdays. I really don't worry about it because there isn't anything I can do about it. If it, you do the things that are suggested and so forth to help minimize that happening. So it's like trying to control life or death. You do the best you can, but like you hear every day, there are things that happen.
Daniel's monitored monthly and does a blood pressure check daily. He also checks in with his cardiologist once or twice a year. Lisa, Jimmy?
Certainly an incredible program.
Now, 2 more patients are going to share their stories later on this month.